I nearly rushed my first foster kitten to the emergency vet 3 separate times in 1 week for completely normal cat behavior. Then, when something actually was wrong, I almost missed it entirely. That's the brutal irony of pet emergencies. You panic over nothing until you're suddenly frozen, unsure if what you're seeing is truly dangerous or just weird. I'm Mariana Vasquez, and I've spent most of my career working with guinea pigs and small animals, but that first experience with a cat taught me something crucial. Recognizing genuine emergency symptoms isn't about paranoia. It's about building the right mental framework so you can act fast when it counts.
You're listening to Total Pet Parent Podcast. Quick heads up before we get going. Everything you're about to hear comes from research and writing done by real people, verified and checked by actual experts. But the voice you're hearing right now is AI generated, so it's a bit of a team effort behind the scenes. Really appreciate all of you who've been listening for a while now. It's great to have you back. And if you're just finding us for the first time, welcome aboard. New episodes come out every Monday, Wednesday, and Friday, so you'll have plenty to dig into. Today, we're talking about something that honestly scares the hell out of most pet parents, figuring out when your dog or cat needs emergency care right now versus when you can safely wait. Let's get into it.
You're going to learn the critical difference between call the vet Monday and get in the car right now. Understand species-specific warning signs that demand immediate attention, and build a mental checklist that works even when you're panicking. This guide assumes no medical background and takes about 15 minutes to get through, but the knowledge stays with you for life. Before we dig into the symptoms themselves, let's talk about what you'll need to have ready. Get your vet's emergency contact information together, including after-hours numbers. Pre-program the nearest 24-hour emergency veterinary clinic address into your phone's GPS so you're not fumbling with it later. Save the pet poison control hotline number in your phone. That's ASPCA at 888-426-4435. You'll want a basic pet first aid reference guide, either digital or printed, something accessible when you can't think straight. Record your pet's baseline vital signs, normal resting heart rate, breathing rate, gum color when they're healthy. Keep a small flashlight or just use your phone light for checking pupils and gum color. Have a notebook or phone app ready to track symptoms with timestamps. And make sure you've got a transportation carrier or secure leash and harness where you can grab it mid-crisis. Now, let's talk about establishing your pet's normal baseline. You can't spot abnormal breathing if you've never counted your dog's normal breaths per minute. This is the step I wish someone had hammered into my head before that first fostering experience. For dogs, a normal resting respiratory rate ranges from 10 to 30 breaths per minute, while heart rates vary wildly by size. Small dogs might hit 100 to 140 beats per minute at rest, while large breeds settle around 60 to 100. For cats, expect 20 to 30 breaths per minute and heart rates between 140 and 220 beats per minute. But here's the thing, your specific dog or cat might run consistently at the higher or lower end of that range. Spend a week observing your pet when they're completely relaxed. Count chest rises for 15 seconds and multiply by 4. Note their gum color should be salmon pink, not pale or bright red. Watch how they move, play, and respond to you. Take a short video of normal behavior. I know it sounds excessive, but when you're trying to describe he's just acting weird to an emergency vet at 2 a.m., that baseline footage becomes gold. Document any breed-specific quirks. Brachycephalic breeds like bulldogs, pugs, and Persian cats naturally sound like small freight trains when they breathe. Greyhounds often have lower body temperatures than other dogs. What's normal for a Chihuahua would be tachycardia in a Great Dane. Moving on to respiratory distress signals. Respiratory emergencies kill faster than almost anything else, and they're the symptoms I see pet parents most frequently misjudge. This isn't about occasional coughing or sneezing. This is about recognizing when your pet cannot get adequate oxygen.
Watch for open mouth breathing in cats. This is never normal and always constitutes an emergency. Cats are obligate nasal breathers, meaning if a cat is panting and they haven't just been playing vigorously for 2 seconds, they're in crisis. Dogs pant normally, but excessive panting at rest or panting that seems labored rather than cooling focused signals distress. Blue or gray gums indicate cyanosis, which is oxygen deprivation. Rapid, shallow breathing where the chest barely moves, or conversely, exaggerated abdominal breathing where the belly pumps dramatically with each breath, both signal severe distress. Listen for wheezing, crackling, or honking sounds, especially in cats, where any audible breathing can indicate airway obstruction or fluid in the lungs. The position matters too. A pet extending their neck and widening their stance while breathing, refusing to lie down, or sitting with elbows splayed outward is trying to maximize airflow. This is called orthopneic positioning, and it's your cue to move immediately. Next up, cardiovascular emergency signs. Heart-related emergencies often disguise themselves as other problems, which makes them particularly dangerous. I learned this the hard way when a foster dog I was caring for seemed just tired one afternoon. Turned out he was an early heart failure. Sudden collapse or weakness is the most dramatic sign, but many cardiovascular emergencies start more subtly. Watch for pale or white gums, indicating poor circulation, cold extremities, check ear tips and paw pads, a rapid, weak pulse that feels thready under your fingers. Unexplained restlessness combined with a refusal to lie down can indicate cardiac distress. Your pet feels like they can't breathe when horizontal. In cats especially, sudden hind leg paralysis or weakness can signal a saddle thrombus, which is a blood clot. This is one of the most painful emergencies felines experience. The back legs will feel cold to the touch, and your cat will cry out in pain when you try to move them. Distended abdomen combined with labored breathing might indicate fluid accumulation from heart failure. Coughing that worsens at night or when lying down in dogs can signal congestive heart failure. This isn't the same as a one-off kennel cough. Let's shift gears to neurological warning signs. Neurological emergencies terrify me more than almost any other category because they can escalate so rapidly. The brain doesn't have much room for error, and time genuinely matters.
Seizures are the most obvious neurological emergency, but they're also surprisingly misunderstood. A full grand mal seizure involves loss of consciousness, falling over, paddling legs, possible urination or defecation, and sometimes vocalization. But focal seizures might look like facial twitching, excessive drooling, or odd repetitive behaviors like fly snapping at nothing. Any seizure lasting more than 5 minutes or multiple seizures in a 24-hour period demands emergency care. Sudden loss of balance or coordination, called ataxia, where your pet stumbles, leans to one side, or can't walk straight, suggests vestibular disease, stroke, or toxicity. Head tilt combined with rapid eye movements points to vestibular issues. In senior pets, sudden vestibular disease can look absolutely terrifying, but might resolve with supportive care. Yet you still need emergency evaluation to rule out stroke. Altered consciousness, extreme lethargy where you can barely rouse your pet, or conversely, unexplained aggression or disorientation signals potential brain involvement. Circling, pacing, or pressing their head against walls all indicate neurological distress. Unequal pupil sizes, or pupils that don't respond to light by constricting, indicate serious problems, possibly increased intracranial pressure. This is where having that flashlight ready matters. Check both eyes. Watch the response. Now we need to talk about gastrointestinal emergencies. Vomiting and diarrhea are so common in pets that it's easy to dismiss them. But certain GI symptoms signal life-threatening emergencies, and knowing how to recognize them has probably saved more pets than any other skill. Bloat, technically called gastric dilatation volvulus, primarily affects large, deep-chested dogs and kills within hours if untreated. Your dog will have a visibly distended, drum-tight abdomen. They'll try to vomit, but produce nothing, just dry heaving. They'll show extreme restlessness and pain. They might pace, pant, whine, and adopt a prayer position where the front end is down and the rear is up. This is a drop everything and go emergency. Multiple episodes of vomiting in a short period, especially with blood or coffee ground appearance, projectile vomiting, or vomiting combined with severe lethargy, all warrant immediate care. Diarrhea with blood, either bright red or black tarry stool, indicates GI bleeding. Straining to defecate with no results in cats can indicate a blocked colon, called megacolon, rather than simple constipation. This is painful and dangerous. In dogs, straining might suggest a foreign body obstruction. Speaking of which, if you know or suspect your pet swallowed something they shouldn't have, string, toys, bones, toxic substances, that's an automatic emergency, even if they seem fine currently. Severe abdominal pain, where your pet won't let you touch their belly, may snap at you, holds their body rigid, or cries when you try to pick them up. This indicates potential peritonitis, pancreatitis, or obstruction. Let's talk about urinary system emergencies. These don't always announce themselves dramatically, which makes them dangerously easy to overlook until your pet is in critical condition. Complete inability to urinate constitutes one of the most time-sensitive emergencies in veterinary medicine. Male cats are particularly susceptible to urethral obstruction, which is a blocked urethra from crystals or stones. But it happens in dogs and female cats too. Your pet will strain repeatedly in the litter box or outside with no urine produced. They may cry out in pain and will become increasingly distressed and lethargic as toxins build up. Check their bladder by gently feeling their lower abdomen. A blocked bladder feels like a hard, round, painful balloon. Left untreated, urethral obstruction causes kidney failure within 24 to 72 hours. This is not a wait-and-see situation. Blood in urine, called hematuria, ranges from pink-tinged to frank blood. While sometimes caused by simple infections, treatable on Monday, it can also indicate bladder stones, trauma, tumors, or coagulopathy, which is a bleeding disorder. Combined with frequent attempts to urinate, straining, or obvious pain, it becomes urgent. Sudden incontinence in a previously house-trained pet, especially if accompanied by weakness, pain, or neurological signs, can indicate spinal injury, bladder rupture, or serious metabolic disease. Now, let's cover trauma and toxicity. Obvious trauma, hit by car, fell from height, attacked by another animal, requires immediate veterinary care even if your pet seems okay. Internal bleeding, organ damage, and shock can take hours to manifest, and by then, you've lost critical treatment time. But toxicity is where pet parents often hesitate, hoping the pet didn't actually ingest enough to matter. Here's the truth. If you saw your pet eat something potentially toxic, don't wait for symptoms. By the time symptoms appear, you're already behind the treatment curve. Common toxins include chocolate, xylitol, which is an artificial sweetener, grapes and raisins, lilies, which are extremely deadly to cats, antifreeze, rodenticides, and human medications. Symptoms of poisoning vary wildly by substance, but watch for sudden vomiting or diarrhea, tremors or seizures, excessive drooling, difficulty breathing, pale gums, collapse, unusual behavior or disorientation, and bleeding from any orifice, which happens with rodenticide poisoning.
Heat stroke deserves mention here. Dogs and cats don't cool efficiently in hot environments. Excessive panting, bright red gums, thick, ropey saliva, vomiting, diarrhea, and collapse indicate dangerous hyperthermia. This progresses to seizures and coma rapidly. Start cooling measures with lukewarm water, not ice, while heading to emergency care.
Here's something that might be the hardest skill to develop, and honestly, I still call my vet when I'm unsure: differentiating between urgent and emergency. True emergencies, where you go now, not in the morning, include difficulty breathing or blue gums, unconsciousness or unresponsiveness, seizures lasting over 5 minutes or multiple seizures, bloat symptoms in dogs, complete inability to urinate, severe bleeding that won't stop with pressure, suspected toxin ingestion, eye injuries or sudden blindness, severe trauma, collapse or extreme weakness, heat stroke symptoms, and signs of shock like pale gums, rapid weak pulse, and cold extremities. Urgent but potentially stabilizable situations where you call ahead and head to the emergency vet, but you have a small window, include mild to moderate bleeding that slows with pressure, vomiting or diarrhea with dehydration signs, but your pet is still alert, limping with possible fracture but stable vitals, bite wounds that aren't actively bleeding, eye discharge with squinting, which might be an ulcer, and straining to urinate with some production. Concerning situations that can wait for business hours, where you call your vet first thing in the morning and monitor closely, include a single episode of vomiting or diarrhea where they're still eating and drinking, mild limping with weight-bearing ability, decreased appetite for one day but otherwise normal, minor cuts or scrapes, ear infection symptoms, and mild coughing without distress. Let me share some pro tips and common mistakes. Trust your instincts. I cannot stress this enough. You know your pet better than anyone, and if something feels wrong, it probably is. I've watched experienced pet parents apologize for overreacting when they brought in pets that were in fact critically ill. No vet worth their license will shame you for coming in. Don't try to feed a vomiting pet or force water on an animal that can't keep fluids down. You risk aspiration pneumonia. Wait for veterinary guidance. Never give human pain medications without explicit veterinary instruction. Ibuprofen and acetaminophen are toxic to pets. Even one pill can cause life-threatening damage, especially in cats. Keep cats confined when symptoms appear. A sick or injured cat will hide, and you cannot afford to spend 45 minutes searching under beds when time matters. Close them in a single room where you can monitor them and get them into a carrier quickly.
Write down symptoms before calling the vet. He vomited 3 times between 2 p.m. and 4 p.m., all food, no blood, seemed weak after the second episode, is infinitely more useful than he's been throwing up. Your brain will not retain details when you're panicking. Don't restrain a seizing pet or put your hands near their mouth. They're not conscious and cannot swallow their tongue. That's a myth. But they can bite you unintentionally. Note the seizure duration, clear objects away from them, and keep them safe. Take videos when possible. That weird breathing pattern, the odd gait, the concerning behavior, they might not do it at the vet clinic, and video gives veterinarians crucial diagnostic information. The biggest mistake? Waiting to see if symptoms resolve overnight. I've heard so many heartbreaking stories that start with, "We thought he'd be better by morning." Nighttime is when most emergencies escalate because pet parents delay. Emergency veterinary care exists for a reason. Use it. Let's wrap up with some frequently asked questions. First, how can you tell if your cat's rapid breathing is an emergency or just from playing? A cat's breathing should return to normal, that's 20 to 30 breaths per minute, within 5 to 10 minutes after vigorous play, and they should breathe quietly through their nose. If your cat continues panting beyond that recovery window, breathes with their mouth open while at rest, shows exaggerated belly movement while breathing, or has bluish gums, that's a respiratory emergency requiring immediate veterinary care regardless of recent activity levels. What should you do first when you recognize pet emergency symptoms? Call the vet or start driving. Call while someone else drives or call hands-free en route. Those minutes allow the emergency clinic to prepare for your arrival and can provide life-saving instructions you should implement immediately, such as CPR guidance, positioning advice, or whether to induce vomiting in toxicity cases. If you're alone with an unconscious or severely compromised pet, prioritize getting to the clinic immediately and call from the parking lot if necessary. Can you wait until morning if your dog seems uncomfortable but not in obvious distress? It depends entirely on the specific symptoms. Severe abdominal pain, inability to urinate, difficulty breathing, repeated vomiting, or pale gums all constitute emergencies, regardless of how mild they seem, while minor limping or decreased appetite can often wait for business hours. When uncertain, call an emergency vet hotline to describe symptoms. They can help you assess urgency level, and most won't charge for that initial triage call.
How do you know if your pet is in shock, and what should you do about it? Shock symptoms include pale or white gums, rapid breathing, weak rapid pulse, cold extremities like ear tips and paw pads, mental dullness or confusion, and in later stages, collapse. If you suspect shock, keep your pet warm with blankets. Position them on their right side with head slightly lower than body to improve blood flow to the brain. Avoid giving food or water, and transport immediately to emergency care. Shock is life-threatening and worsens rapidly without intervention. So here's what you need to take away from all of this. Learning to recognize pet emergency symptoms in dogs and cats transforms you from a panicked pet parent into someone who can act decisively when it matters most. The key lies in knowing your pet's normal baseline, understanding which symptoms demand immediate action versus those that can wait until morning, and trusting your instincts when something feels wrong. Watch for respiratory distress, especially open mouth breathing in cats. Look for cardiovascular signs like pale gums, collapse, and weakness. Notice neurological changes such as seizures, disorientation, or sudden loss of coordination. Be alert to GI emergencies like bloat symptoms, bloody vomiting, or diarrhea, and watch for urinary blockages, especially straining without production in male cats. When in doubt, make the call or make the drive. No one has ever regretted seeking emergency care for a genuinely ill pet, but many have regretted waiting. Keep emergency numbers programmed, know your baseline, and remember, that nagging feeling that something's wrong is data too.
That wraps up this episode of Total Pet Parent Podcast. Thanks for listening all the way through. I know this one was packed with information. Just a reminder, we drop new episodes every Monday, Wednesday, and Friday. If you found this one helpful, would you mind leaving a 5-star rating and maybe a quick review? It actually makes a real difference. It's how other pet owners find the show when they're searching for answers. And if you haven't already, hit subscribe or follow so you get notified the second a new episode goes live. Catch you on the next one.